Dr. Joe, thank you for joining me. Tell me, Joe, you obviously are like Harvey and Rich and Tony, that you've been in the field really since its inception and in the society since its inception. Let's talk about echo. When were you first exposed to echo, and what did it look like at that point in time?
I was exposed to echo in the mid-1960s as a medical student in Philadelphia. The fact that you could see inside the heart was enough for me. That's what I wanted to do.
What was the technology like, though? I mean, because a lot of people that will be watching this will think about today's technology, not 1960 technology.
Well, we had one common denominator back then, and that was called the Echo Line at 20A. And that was a simple Mmode machine, and everybody had it. It was the only one made, and that's what a lot of us just learned on.
So was it a M mode? Was it an A mode? What was it?
That was an Mmode machine, and it simply displayed it on an oscilloscope. We took pictures, of course, with Polaroid film, and we were pretty lucky if we caught the abnormalities as the beam swept up or down, as the case may be, as you set up the machine.
You did a fair amount of pediatric stuff too, didn't you? Were you using it in that sense?
I first applied it in my fellowship when I did pediatric cardiology at Yale. And of course, trying to figure things out then was really quite difficult. I certainly practiced on myself enough. And I must say, to this day, it's very hard to find my mitral valve. But I was thankful when that first patient came along that happened to have anemia and renal failure. And that was glorious. We could see the heart, and I could tell what was what.
Joe, we went through a lot of the earlier days with about the M mode, and Walt talked about different ways of recording images and all that sort of stuff. But you were really not only instrumental in a lot of the early days of M mode, but 2D echo. Tell me about how your exposure to 2D echo came along.
So, well, two-dimensional echo for me began with phased array, as my colleagues Fritz Thurston and Olaf von Ram at Duke invented it for cardiac use. And I remember that first night that we examined Fritz Thurston's daughter, actually, and could see the heart in 2 dimensions. That was really exciting to hold the transducer then. So we could see a ventricle, we could see a mitral valve, we could see the aorta, and actually we saw coronaries that very first day. And from there on, phased arrays grew, and now phased arrays are used around the world.
It's a phenomenal when you think about it. And I was fortunate enough to be at Stanford, going from M mode to 2D, and also, and I mean, just the ability to see things in a different way were incredible. When you saw it, so you saw it and you all were excited about it, what did you think about applying it to? What questions did you need to go out and answer that you thought 2D would give you?
Well, questions about 2D were pretty obvious. We could tell the size of a ventricle, which we could by M mode, but we could certainly tell specific wall motion abnormalities, which of course M mode was very difficult at doing. We then could see morphology of valves, not just the movement, but we could see the morphology of a valve. And obviously what we know today is typical rheumatic mitral valve disease. We were not able to appreciate by M mode. Or vegetative endocarditis. We could actually see the vegetations in 2 dimensions. There were so many applications to begin with. Now I must add, as we went around and we talked about 2-dimensional echo, there were so many people that said, why do we need this? We've got M mode. We could see a pericardial effusion just fine. And that was true. But what 2D echo did was, so it provoked all brand new questions. And it just boomed from there with so many new questions. And we could answer many of them.
So, Joe, if I recall right, you were the 4th president of the American Society of Echo. What was the American Society of Echo like in the early days? And then I'll come to your presidency. But so how did you get active with the American Society of Echo?
Well, I got active with the American Society of Echocardiography the first night it was formed. And that was essentially Harvey Feigenbaum's meeting, and all the participants in that meeting were automatically on the board. So when that was started, and of course, the problem was the battles with the radiologists and reimbursement, and that's what provoked the society. And along the way came a lot of other issues.
Yeah.
Establishing cardiac sonography is but one example. It went from there to setting up the initial standards, the initial documents, and so many things of just standardizing an echocardiographic examination. There were many things to do, and there still are.
You did, during your presidency, you did a lot of good things, but basically the establishment of the relationship with Sharon Perry and the whole sort of organizational structure of that. Tell us a little bit about that.
Well, when I became president, Walt Henry had done some organization. What Walt had done was to computerize this. We had actually a list of names and addresses in a computer. We had not done much with that, but we had a list. And what was delivered to me was a computer and some help from Estelle Cohen as to how to run the computer. And from that point on, we at least had a membership list. It was obvious, though, from my association with other societies, not only the American College of Cardiology, but the American Institute of Ultrasound and Medicine,
right,
and other organizations, that we needed some administrative organization. It was not just going to be from the president's office. And there were many bids that we put out for that at the time. And I remember talking to the executive director of the American College of Cardiology at the time, Bill Nelligan,
Right.
and seeking his advice as to who might do this. We had asked the American Heart Association if they would serve as our executive arm. Mm-hmm. And we had also asked the American College of Cardiology to serve in that capacity. Mm-hmm. For a variety of reasons, most of which they did not want to segregate cardiology in any way. Mm-hmm. That was not, they were not viable alternatives. Mm-hmm. Bill Nelligan then suggested that I talk to this fellow in Raleigh, and his name was Mike Olson, mm-hmm, who had an organization called Olson Management. And we had several bids in from a variety of different organizations to manage us. I only presented one to the board, and the board was very small then. But it went something like this. I met with Mike in my office. He invited me to Raleigh, and I went to this ancient old building in Raleigh, North Carolina. One of these buildings that had the old brass sort of postal chutes and the post office box on the wall. We went up in this old elevator up to I don't know what floor. And there was Mike, and he said, I just have the perfect person for you to run this organization. And that was Sharon Perry. And I met Sharon, and I was convinced then that was our only alternative. Number one, it was Mike. Number two, he introduced me to Sharon. And number three, I only lived about 15 miles away, so it made sense. And from that point on, Olson Management and Sharon Perry, they became a fixture of the American Society of Echocardiography and helped us to build.
Yeah, I mean, I don't think the society would have gone if that hadn't occurred. I mean, or it may have struggled along, but I mean, I think, Sharon certainly and Olson helped us out tremendously. Sharon especially developed an incredible relationship with the society, its members, and presidents that followed you. Isn't that correct?
Sharon was the key,
right,
that made it work.
Right.
I think the second key, though, that it was a part of Mike Olson's philosophy, that the executive director of the organization should be close to the organization. Sharon was the perfect personality. And as well, Mike's organization was the perfect organization. It was not expensive. It was not Washington, and it was not New York, and it wasn't Boston. It was Raleigh, North Carolina, and it just worked. Sharon was the key.
Yeah, absolutely. And Sharon had was perfect for the society and a fabulous person. And a lot of excellent relationships developed. Joe, you mentioned something earlier about the sort of the whole sonographer thing, and obviously your wonderful wife, Kitty, was a instrumental sonographer when I was a fellow at Stanford in the early days. But the role of sonographers as colleagues with us as echocardiographic physicians, let's say whether we're pediatric cardiologists or others, is pretty unique, isn't it?
The role of sonographers is clearly unique in terms of allied health professions. In the early days of echocardiography, in the Mmode days, I don't think that relationship was as well established as when two-dimensional echo came along. That sonography with two-dimensional echo began as a physician-performed procedure.
Mm-hmm.
We actually at Duke didn't allow the sonographers to do it because it was just too complex. And as well, the sonographers who were trained by Mmode, they would always do an Mmode guided two-dimensional exam, which is kind of silly in this day and age. But along the way came several sonographers that stood out, that were developed in a professional sense, that could understand a physician decision-making process, that began to understand the equipment and the cases, and sonography then became an established allied health profession. Amongst these sonographers was a woman at Stanford by the name of Kitty Philly at the time. And Kitty was involved in training individuals such as yourself, Harry Rakowski, and other individuals. And through Art Hagen, actually, who was a physician in San Diego, who was very interested in training sonographers in the early days. I got involved in that. Kitty got involved. Sandy Hagen-Ansert was another early sonographer that got involved. And together, the four of us really began to develop the definition of what a sonographer was. And then dealing, through the American Medical Association, actually establishing sonography as a legitimate allied health profession came several years after that.
That's interesting. I didn't know that. I mean, I knew it would establish, but I didn't have any idea about the roots. That's important. You have been at the cutting edge of the development of lots of echo techniques. Obviously, 2D stands out to me, but 3D echo. You've been at the cutting edge of that, both transthoracic and with technology now transesophageal. Where do you see echo going in the future? Where do we go? I mean, you and I have been around long enough to hear people say, "Oh, we don't need that," as you already referenced. We don't need that. But you've been on the cutting edge of all of these. Where's echo going in the future?
I've certainly been there with the initiation of two-dimensional echo, and for years we toyed with 3D echo, trying to make three-dimensional pictures, and actually accomplished that. And that was incredible, too, to hold those transducers and try to figure those early pictures out long before anyone else ever even attempted it. And I think that echo is going in the natural progression of multidimensional high-speed imaging. The fact that ultrasound now can go in multi-dimensions, it's got to be able to go faster. And there are techniques that can make it go faster, or at least we receive information faster. High-speed imaging is, I think, our next frontier. The movement of the hearts that we've seen with our experimental devices are remarkable. Just to see, I honestly believe we can see the muscle reordering itself. We go at frame rates of 600 frames a second, 40 and 50 and 60 volumes a second in three-dimensional. There are movements of the heart that are bound to be telltale signs of disease and abnormalities of contraction and relaxation that are absolutely yet to be described.
So you're really talking about harnessing not only the technology but incredible computer powers to spit out something that's useful. Is that correct? Is that what you're telling me?
There's no question that ultrasound has been dependent upon computer processing, simply because phased arrays have to steer a beam and computers need to be able to set those formats. but the concept of parallel processing of received signals and sorting out all these complexities of motion and speed and parallel in time or space are certainly things that computers are now able to do. And those will be the ones that will give us these answers to these complex movements.
You're describing almost an avatar, if I'm dating this interview, avatar-like sort of this incredible development. What about handheld ultrasound? You know, you've been involved in that too. Where, you know, what's that going to do? Is there a role? What's that going to do?
Well, it's amazing to me that the handheld devices that you just hold in your hand are as powerful as the early two-dimensional phased arrays that were developed at Duke. They were huge machines, 4 or 5 racks wide with 6 foot high, that these handheld devices are able to see things at frame rates and resolution capabilities like the old machines. Handheld should be a part of every physical examination, so performed by any physician whatsoever. If it's the heart, that's one thing, with simple questions. What's the size of the heart? Does it move well? Mm-hmm. It does not require the complexity of detail that we know in modern echo exams. How big is a patient's the liver? Mm-hmm. How big is the descending aorta? The simple things. Mm-hmm. There's no doubt that physical examination is inferior in this day and age, and probably even in past days and ages too. And if we could see the heart, that's a lot better than just guessing.
No, go ahead. Excuse me, go ahead.
Handheld will succeed when it's included as a part of the physical examination.
Joe, so going back to your presidency and certainly establishing the sort of the real business structure of the organization, think about, let me get you to shift a little bit, think about the individuals involved with the American Society of Echo, and specifically your colleagues who've been president like you and others who played a key role. What's distinguished them and contributed to the success of the field and the society? You understand what I'm saying?
Yeah. People that have been presidents of the American Society, beginning with Harvey Feigenbaum, and progressing through the others, have certainly had a dedication to the technique and developing new applications or technologies. The thing that's mostly distinguished them, however, is their dedication to wanting to see these applications done by large numbers of people and actually to affect and change patient care. There's no question about that. They've all taken the time and the effort to interrupt their lives, so to be able to say, we want to make echocardiography a better tool. And indeed, I think it's those individuals that were willing to give their time. They all had direction. Everyone had a different direction. Mm-hmm. One might have had a reimbursement as a major issue. Another might have had the development of standards or other things. The job is and was endless. And while modern presidents spend a lot of their time, they've got a lot of help. And past presidents in the early days spent a lot of their time and didn't have much help. So the time factor is one that everybody's got to be able to give up their time for the good of the society.
No, you're exactly right. You know, you've made tremendous contributions all the way along. I think one of your biggest contributions personally has been your dedication to education. And education, both in a small way and then a large way, your teleconferences that you really sort of propelled, really reached the world. You mentioned something to me when we were sitting down about exhibiting a booth, the echo booth at non-echo meetings. Tell me a little bit about that, and I'll come back to where I was going with the teleconferences.
Well, education was not a direct part of the society in the early days, but as it progressed, certainly about the third or fourth president, and I was about the fourth, that education became something that was important for the society to do. The early educational items were self-examinations. We didn't have a booth at major meetings before that. And through Sharon and Olson Management, we actually got a booth. And there was an old sign that was painted with American Society of Echocardiography that was unrolled. I think it was on a plastic tablecloth that was unrolled. And we established ourselves as a presence. The early examinations, self-examinations, were the first participation of the society in terms of teaching and setting standards. Now that obviously developed into what we see now as all of our educational endeavors. Over the years, education has varied. 3-day meetings, a variety of things like that. But fundamental education about how the heart works, especially for those already in practice, became a very important thing to do. I'm not even so sure that today we offer enough of that, of the fundamentals about so what basic cardiac physiology and performance is. We tend now to be teaching about techniques or the latest craze or the blinking lights from the machines that blink on and off. But the fundamental parts about do people understand the heart is still something that I think the society has to do forever.
You've been, as I alluded to, as with this sort of presence as really a major mover of education, of educating others about echo worldwide. And you've had, I know, the fortune to travel throughout the world numerous times. What struck you about echo as you've traveled throughout the world? What do you hear? What's a common theme you hear?
Well, as I started and as two-dimensional echo developed, there were many opportunities to travel into many places and see many things. And my friend Alessandro Distante, who is from Italy, would describe the echo people as the artists, like the Renaissance artists were. They traveled from place to place and actually helped to develop culture. That might be an overstatement to some degree. But ultrasound is the language of the heart. Simply seeing a picture is enough to overcome a lot of language barriers. And so I think it helped modern cardiology develop simply because we could see the heart. And when we all described things, we could see it in the pictures as something as simple as that. The common thing about echocardiography around the world is, though, the direct application to patients. Is there any more intimate examination that we can perform on a patient's heart than holding a transducer to their chest? It's even more ways intimate that you can imagine than a stethoscope on the chest or even a hand on the chest wall. And so this kind of the touching and closeness to a patient and their disease, I think, is something that distinguishes echocardiography, echocardiograpers. It's not just a picture. It's the patient at the end of our hands and who's there at the end of the transducer. And I think that's a remarkable point.
Absolutely, no doubt. Final question. What, as you look back over your career and your involvement and critical involvement with the American Society of Echo, what do you think the American Society of Echoes meant to you personally, the organization, the relationships, and to us professionally?
Well, the American Society of Echocardiography, without question, helped to define a group of people that had common interests. And it came along at a time when cardiology was booming. Cardiac catheterization had just begun. Certainly coronary bypass as a viable operation had just become, had just started. And so it was the society was able to distinguish us as a subgroup. It was able to distinguish us as individuals who wanted to educate about the morphology and the valves and the physiology, when the rest of cardiology was going off on what's the percent stenosis of a vessel. And so I think it laid the groundwork for modern technology, sort of with a heart. It certainly laid the groundwork for nuclear, certainly laid the groundwork for MRI and CT, and the many things that came after that.
Super. Listen, I really appreciate you taking the time to visit with us, and obviously all of us appreciate your many, many contributions. I mean that sincerely. Thanks.
You're welcome.